Hello guys, today we're going to learn about the inguinal region, right? Inguinal region, and we're going to be acquainted with some names, right? And in the inguinal region class, we're going to learn about inguinal ligament, femoral sheath, femoral canal, and the all-important inguinal canal, right? Today we'll learn about inguinal ligament, femoral sheath, and femoral canal. Inguinal region is a groin, right, with the junction of the anterior abdominal wall and the anterior aspect of the thigh. So this is the transitional area, right? The transition to the thighs, right? Lower limb, from abdomen to the lower limb. So all the vessels, neurovascular structures, and some of the muscles pass from abdomen through abdomen to the lower limb through this region. That is why it is a important region to know both anatomically and especially clinically. It extends between the anterior superior iliac spine and the pubic tubercle. Let me show you. Right. So this is the abdomen, right? Anterior abdomen. This is the lower limb, right? So this is the transitional area we are talking about, right? From abdomen to the lower limb, you see this vein, femoral artery, femoral nerve, lateral femoral cutaneous nerve of the thigh, right? All these passes along with iliopsoas, right? And many muscles. So this area is called as groin or inguinal region, right? So we have already learned that in the anterior abdominal area, groin is the weak area, right? It's a weak area. That means the contents of the abdomen in sometimes produced through this area, right? Because of the weak musculature in this area, causing femoral hernias, especially inguinal and femoral hernias, right? So this is that area, okay, we are talking about, right? So this is the inguinal area. In this area, the abdominal wall is weakened, right, from changes that occur during development, and a peritoneal sac or diverticulum with or without abdominal contents can therefore protrude through it. We have already discussed this in the previous classes. The key structures in this region are inguinal ligament, inguinal canal, and femoral canal. Hence, surgically, it is the most important region. Coming to the inguinal ligament, right? The inguinal ligament is a thick fibrous band extending from the anterior superior iliac spine to the pubic tubercle, right? You see, so this one right here from let me show you again. So this is the anterior superior iliac spine, right? What we call as ASIS. This is the pubic tubercle, right? So between these things is the extending this thick fibrous band which is called as inguinal ligament, right? This one, right? Inguinal ligament. It lies beneath the fold of the groin. It is found by the lower free border of the external oblique aponeurosis. Remember that external. This is the thickening of the external oblique aponeurosis. We have already dealt with us in the previous class of muscles, right? Which is thickened and folded backward on itself. Thus, the lower aspect of the ligament is round, while its upper aspect presents a groove. The grooved upper surface of the inguinal ligament forms the floor of the inguinal canal. So, inguinal ligament forms the floor for the inguinal canal. The strong, deep fascia of the thigh, fascia lata, is attached to the lower aspect of the entire length of the ligament, which makes it convex inferiorly by its pull. So, the fascia lata pulls the inguinal ligament, right? So, you see, this is the inguinal ligament, right? So, this is the aponeurosis of the external oblique. This external oblique muscle, we'll see that. Show you, right? So you see, this is the external oblique muscle, right? External oblique muscle. See this. So this is the inguinal ligament, right? This is external oblique muscle, and this one is the inguinal ligament. So this is just nothing but the thickening of the external obliques aponeurosis, right? So you see how it is folded onto itself, forming the inguinal canal, which pass the spermatic cord, right? We already seen that in the previous classes. So inguinal ligament has somewhat extension types. So it expands to other regions, right? We'll see that lacunar ligament or Gimbernard's ligament. From the medial end of the deep fibers of the inguinal ligament curve horizontally backward to the medial part of the pecten pubis, forming lacunar ligament. So it attached to the pecten pubis. This ligament is triangular in shape with apex attached to the pubic tubercle. Its short lateral edge forms the medial boundary of the femoral canal. So femoral canal is different from inguinal canal, right? The medial border of the lacunar ligament forms the lateral edge of the lacunar ligament forms the medial border of the femoral canal, which is the site of the production for humeral hernia. So if the lacunar ligament is weak, there is more prone for femoral hernia, right? You see, this is the lacunar ligament, holding of the inguinal ligament, extending of the inguinal ligament to the pecten pubis, right? And here you see, this is the femoral artery, femoral vein, and you see here there is also an extension in the femoral sheath, right? You've already seen that during dissection. See, there is lymph nodes in this. It is called as femoral canal, right? So femoral hernia herniates through femoral canal. So what happens? I'll show you. Just wait. So you see, if this lacunar ligament is weak, okay, there will not be any opposing force for the femoral hernia to herniate through the femoral canal, right? You see, this is the perspective. You see, this is the inguinal ligament, right? And you see this is the pubis, pubic tubercle, pecten pubis. This part of the folding is called as licunar ligament, and this is called as pectineal ligament along this line, the same fibers, right? You see this is the lacunar ligament, inguinal ligament, lacunar one is here. Coming to the pectineal ligament or ligament of Cooper, it is the extension of the posterior part of the lacunar ligament along the pecten pubis to the iliopectineal eminence. So this is nothing but the again the upper neurus of the external oblique, extension of the inguinal ligament or the lacunar ligament, right? Some authorities regard this as beginning in the upper part of the pectineal fascia. You see, this is the pectineal ligament. See, this one, right? And coming to the reflected part of the inguinal ligament, the superficial fibers from the medial end of the inguinal ligament, right, expand upward and medially to form this ligament. Upward and medially, superficial fibers of the medial end of the inguinal ligament, right? You see. So you see, this is the medial end, right? Medial end. Whereas this one is a lateral end, right? So these superficial fibers of the medial end going upward and medially, right? Upward and medially, right? To form a, right? Upward and medially to form this ligament. So this is called as reflected part of inguinal ligament or reflected ligament, right? So this is called as reflected ligament, right? So that is the orientation. It lies behind the superficial inguinal ring and in front of the conjoint tendon, right? Conjoint tendon is a, if you remember, is the joining of the both aponeures of the transversus abdominis and internal oblique muscle, right? Its fibers interlace with those of the counterpart of the opposite side at the linea alba, right? So you see, this is the inguinal ligament. This is the superficial inguinal ring, right? So lacunar ligament is the under surface, right? Reflected ligament, you see. This is the reflected ligament, you see. Right, medially. Ilioinguinal ligament, it is a fibrous band extending from the inferior aspect of the inguinal ligament to the iliopectineal eminence, right? So, inferior, from inferior aspect of the inguinal ligament to the iliopectineal eminence is called as ilioinguinal ligament. So this is a sagittal section. This is the inguinal ligament, right? This one, green one, and this is the lacunar ligament. Blue one is the pectineal ligament, right? Coming to the space called subinguinal space or pelvifemoral space. The space between the inguinal ligament and the hip bone, right, is called as pelvic-femoral space or subinguinal space. That means through which everything enters. So you see, so this is the space. I've already seen that. So this space is called as pelvic-femoral or subinguinal. So this is the space through which everything passes from anterior abdomen to the lower limb, like this, right? You see, this is the subinguinal space, right? So this one, right here, right? Through which everything passes to the lower limb, including muscles, neurovascular structures, right? We call this as pelvic-femoral space or subinguinal space, right? The muscle, psoas major and iliacus, neurovascular structures of post-abdominal wall, pelvis pass into the femoral region of the thigh through this space. The space is divided by the ilioinguinal ligament or ilioinguinal arch, right, into two parts. Large lateral part is called as lacuna musculorum, right? That means there lies the muscles, lateral part. Small medial part is called lacuna vasculorum, right? The iliacus and psoas muscles and the femoral and lateral cutaneous nerves of the thigh pass through the lacuna musculorum behind the fascia iliaca. That means fascia of the iliacus muscle. The external iliac vessels in the abdomen became femoral vessels as they passed through the medial part of the subinguinal space, the lacuna vasculorum. I have already said the same vessels continue everywhere. So, what the external iliac artery becomes femoral artery immediately after it passes the inguinal ligament, right? So, external iliac vessels in the abdomen become femoral vessels as they pass through the middle part of the subinguinal space. The fascial lining of the abdomen is prolonged into the thigh to enclose the upper 3.7 centimeters of the femoral vessels, forming the femoral sheath. See, you have already seen that during dissection, right? Femoral sheath. So the fascia iliaca and fascia transversalis pass up to the 3.5 centimeters into the lower limb from abdomen, enclosing the femoral vessels, excluding the femoral nerve. That is why femoral nerve lies outside of the femoral sheath. We have already learned that, right? So you see, these are the compartments, right? This is the vasculorum musculorum, right? Iliacus, psoas major, right? Whereas here vasculorum, we have femoral vessels, artery, vein, and femoral canal, right? So this, you see, here lies the muscles and the nerve, right? This is musculorum. Here lies medial space, which is somewhat compared, a little space compared to the lateral end of the, that is called muscular, right? Femoral artery and femoral vein, right? You see here the iliopectineal arch, okay, that is called as iliinguinal ligament, right? You see this one, right? Observe that carefully. So that is making the subinguinal space into two parts, two compartments, right? Coming to the femoral sheath. It is a funnel-shaped fascia sheath enclosing the upper 3.5 centimeters of the femoral vessels. We have already seen that. The base of the sheath is directed upward toward the abdominal cavity. So base is towards the abdomen and apex merges with the tunica adventitia of the femoral vessel. So the apex gradually continues with the vessels. The anterior wall of the femoral sheath is formed by the downward prolongation of the fascia transversalis, right? The anterior wall is from the transversalis fascia, whereas the posterior wall is from the downward prolongation of the fascia iliaca. That means iliacus fascia, iliacus muscle, right? I'll show you. I will come to it again in a minute, right? Lost track of it. Did it get deleted or not? CP. I'm sorry for the delay. I'll show you here. So here, this is external oblique, right? We'll, we'll dissect slowly. So you see, this is the iliacus muscle and this is psoas. We'll hide that. This is arterials. So this is iliacus muscle, right? I will add external. So you see, this is transversus abdominis, right? This is iliacus. So the femoral sheaths, I will add femoral vessels, right? So you see, so the sheath, right? So the sheath from this one iliacus posterior sheath, right? From this one transverse abdominis, anterior sheath. So this comes up to the 3.75 centimeters, right? And extend as a sheath, right? So this may not be occur to you. And this selected structure, right, is femoral nerve. You have already seen this in dissection, right? Femoral nerve lies outside the femoral sheath. It is called as femoral sheath, coming from transverse abdominis and iliacus muscle, right? So the medial part of the femoral sheath, medial compartment of the femoral sheath doesn't have anything except a small lymph node called as cloquet lymph nodes. So this part is called as femoral canal, right? Through which femoral hernia occurs, right? So that is femoral sheath. The femoral sheath is not symmetrical. Its lateral wall is vertical, whereas its medial wall is oblique, being direct downwards and lateral. Compartments. The inferior of the femoral sheath is divided into three compartments by two anterior-posterior fibrous septa, right? That means like this. 1, 2, 3. Lateral compartment lodges the femoral artery, right? This is artery. Femoral artery, the genital branch of the genitofemoral nerve, right? Middle compartment contains the femoral vein, right? This is the femoral vein, and the medial compartment is relatively empty and is called as femoral canal, right? Which has a lymph node. It contains a lymph node of cloquet and a fibrofatty tissue, right? You see, this is the femoral sheath, and this is femoral canal, medial end of femoral sheath. So the femoral nerve lies outside the femoral sheath, right? So you see the sheath-like structure, this, right? Observe that carefully. Okay, you can clearly see that in the real dissection, and we have already seen that in our cadaver. Right, this femoral sheath, right? This fascia, transversalis, and iliacus fascia, right? Anterior part is transversalis fascia, whereas posterior part is iliacus fascia. So you see this fascia transversalis anteriorly, and fascia iliaca posteriorly, forming up to 3.75 centimeters, right? You see, this is the cloquet rosenmuller femoral branch of genitofemoral. Now, this one anterior fibrous septum and posterior fibrous septum. Femoral artery, vein, and here lies femoral nerve. You see, right? Lateral compartment, intermediate compartment, and middle compartment. Coming to the femoral canal, it is a short fascial tube, middle compartment of the femoral sheath, which diminishes rapidly in width from above downwards. Right? That means it becomes narrower from above downwards and is closed inferiorly by the fusion of its walls. Right? Upper end of the femoral canal, which opens into the abdominal cavity, is called femoral ring. So the femoral ring opens into the abdominal cavity. A fatty areolar tissue called femoral septum normally closes it. Cloquet's node is a lymph node situated in the femoral canal. The canal provides a dead space for the expansion of the femoral vein during increased venous return. See, so when the venous return is increased, the space helps to bulge of the femoral vein. Anteriorly, inguinal ligament, medially sharp edge of the lacunar ligament. Right, we have already seen this. Because of this, if the lacunar ligament is weak, there will be the persons will be more prone to femoral hernia. Right, posteriorly pecten pubis and laterally femoral vein. Below the inguinal ligament, the canal lies posterior to the saphenous opening and thin cribriform fascia, right, and anterior to the fascia covering the pectineus muscle. So that is femoral sheath and femoral canal. Coming to the another specialized area, iliopubic tract. It is a thickened inferior margin of the fascia transversalis, right, which appears as a fibrous band running parallel and posterior to the inguinal ligament, right. Remember that, parallel and posterior to the femoral ligament. That means the same inguinal ligament is thickening of the aponeuros of the axonal oblique, whereas this iliopubic tract is thickened inferior margin of the fascia transversalis, which runs along the inguinal ligament but posterior. When the inguinal region ligament is viewed from its posterior aspect, right, the iliopubic tract is seen in place of the inguinal ligament. That means if you something you see, if you see the inguinal ligament from posterior aspect, right, so this one is the inguinal ligament, right. So you won't see, if you see the inguinal ligament from this angle, posterior angle, you won't see the inguinal ligament. You will see a thickened fibrous band, right? Thickened fibrous band of transversus abdominis, right? So what you will see is iliopubic tract. It is called as iliopubic tract, right? So posterior view of the inguinal ligament, you will see the iliopubic tract thickening of the transversalis of the aponeuris of the transversalis, right? With that, we end the lesson today. See, this is the iliopubic tract, right? If you have any doubts, let me know, right? Please let me know the doubts.